Hi, I'm IfyDika. Welcome to my channel. If you're a first time viewer, a very special and a very big welcome to you. Whoop, whoop. In my channel, I talk about health, mostly health related videos, issues rather, and I explain them in very simple and fun way as much as I can. And I also do different videos about lifestyle and family. So very big welcome. I hope you have the opportunity to watch other videos of mine. Anyway, so today I'm going to be talking to a very good friend of mine, ID. ID is my very good friend. I've known her for a long time. And we're going to be talking about diabetes. And I'll be joining her right now on the Zoom call. So catch us. Let's go there. Let's go there. Let's go there. Hi. Okay. Welcome to today's edition. Anyway, hi, Adi. Welcome. Kindly introduce yourself.
Hello. My name is Nkan. I am Ifeama's friend, sister. So I'm happy to be here.
I'm really happy to have you. I think the last time okay. I thought you said the last time we saw was during Christmas, but I remembered we've had Zoom calls. But then it mean
But that's the last time we saw for real. The other ones are just,
Yeah. Anyway, so today we'll be talking about diabetes in respect to World Diabetes Day that is marked on November 14th. So, we'll be talking about different things concerning diabetes to create awareness and also to educate people regarding the diabetes. Is it a disease or it's a disease, right? Oh, no, anyway.
What do you mean by is it a disease?
There are some things people don't actually call diseases, I just want to. Anyway, so diabetes mellitus, which is actually the full name, but it's commonly called diabetes, is a metabolic disease. Yeah, disease. It's a metabolic disease that causes high blood glucose levels. So, can you talk about insulin and the role it plays in diabetes?
Okay, so before I start here, I would like to talk about the pancreas, which is the which produces this insulin.
Yeah.
So pancreas has both like the endocrine and exocrine functions. So the pancreas is responsible for the production of insulin, like I said, the beta cells, which are responsible for the production of insulin, also responsible for production of glucagons, which are the alpha cells, from the alpha cells. And then we have the amylase, the lipase, and the protease. These are things that break down carbohydrate, proteins, and fat in the body.
So these are enzymes.
Yes, those are
enzymes.
But I wouldn't refer to insulin as an enzyme. I would rather refer to it as a hormone.
Mm-hmm.
Yeah. So what this insulin does is that it kind of pushes sugar into the cells, so that pushes blood sugar into the cells. Do you understand? So if someone has like maybe a high sugar, somehow the insulin helps to push it into the cell for the body to use it for energy.
Okay. So now speaking of diabetes, I know there are different types, but the one people commonly hear is type 1, type 2, and people might not really know which is which, but I know there are other types other than type 1 and type 2. So can you just brush on the different types of diabetes?
So type 1 diabetes is like, how do I put it? The antibodies in the body fight against these beta cells that produce this insulin, and they cause a defect in the production of this insulin. So in this case, like the patients do not have like, how do I put it? The body is not producing insulin that is supposed to push this sugar into the cell.
Okay.
Whereas in type, the body is producing, but it's not sufficient. Do you understand?
In type 2.
Yes, in type 2. And then in type 1 as well, it can occur at any age. So we have, so you could see a young person with this diabetes. Do you understand? Whereas in type 2, you see people who are obese, there are certain risk factors that can predispose you to a type 2. So maybe your father had diabetes, your mother has diabetes or something. So there's always a family history in type 2. So then we have gestational diabetes. Gestational diabetes usually occur in pregnancy. So in this case, like the woman might not have been diabetic before pregnancy, but then she now has diabetes when she's pregnant. So we just diagnose this as gestational diabetes. Then we have maybe the latent autoimmune diabetes in adults. So that is a form of type 1 diabetes. And we have the maturity onset of diabetes in young. So that's a form of type 2 diabetes.
Okay. And then the pre-diabetes?
Okay, for pre-diabetes, these patients are usually at the borderline. We have different ranges for diabetes. So these patients are usually at the borderline. In this case, they are not diabetic at all, but if there's no lifestyle modification or prevention, they could become diabetic.
Okay. So what are the symptoms of diabetes?
Can you smile? You look so serious.
What are the symptoms of diabetes?
Okay. So there's something we call polydipsia, polyuria, polyphagia. That is increase in thirst, increase in hunger, and increase in frequent urination. So you see someone comes to you like, oh, I have I've peed like more than 5 times in the night, right? I'm always getting thirsty. I'm always getting very hungry. So these are like first things that we always, let us rule out. Let us rule out diabetes. So they could also come with complaints of weight loss, weakness, and they could also come with, I'm usually having boil on my skin. Do you get? So you think towards that direction. But some of them, will not come when all these things have started initially. They come at when it has become complicated. So you can now start, maybe this person will come and tell you, oh, like I'm talking about the complications of diabetes, right? So they will come now and tell you, oh, I noticed that I'm no longer seeing well. I'm having like blurred vision. They can come and tell you that I'm having kidney issues. Maybe I've not been able to. I don't know how to explain this in like issues with seeing.
Is it like things maybe after you've had the disease, there are other kinds of things that attach with people that have the disease?
No, what I'm saying is that some people do not know that they are diabetic because they don't check. And then in the long term, it becomes complicated, right? So now they have issues.
Eye issues, and then their wounds won't heal.
Yes, kidney issues, eye issues, they complain of numbness. Do you understand? So even sometimes, like in patients who are diabetic, you notice that some of them come and complain that they've been taking their drugs regularly, but they've been feeling maybe really weak. So hypoglycemia, maybe frequent tests, they sweat a lot. Do you understand? So you start suspecting, okay, these patients might have taken an overdose or maybe
Okay. Sure. You just use the big word for my viewers, hypoglycemia. Break it down.
Hypo is more like a low.
Okay.
Sugar level, so low sugar level.
Okay.
Then hyperglycemia is high sugar level.
Okay. Go on, doc.
Oh God. So what was I saying?
You were
I was talking about the complications. You see, you two, you don't need to follow that. So I was talking about the complications that could arise with diabetes. So, and then there's something we call you see ketones in the urine. You see, like basically weight
Kettles?
loss, ketones.
Okay, ketones.
So, how do you pronounce it? Sorry,
Ketones.
ketones. All right, ketones.
So
Basically, they, like I said, the frequent urination, frequent like they eat a lot. They are always thirsty. So those are like symptoms that maybe someone will complain to you, and then you say, okay, let's check your sugar level. But then, like I also said, the complicated form, you see
but what
issues
about
with
the people that eat a lot normally that are gluttons? Would they say?
Well, I would say I use people that eat a lot, right? If they don't have any issues with the insulin production or reabsorption of breakdown of all the sugar and all of that, I wouldn't say that those people are, diabetic. But obesity is a predisposing factor for diabetes.
Oh yeah.
Type 2. Do you understand? Family history as well. So
Okay. Okay. I don't know why this keeps entering my mind. I don't know if it will be weird, but people who you hear people's, I don't know if you've heard this, the people say like, you're drinking too much coke, eating too much sugar, this and that, diabetes. That does it actually work like that when you eat too much sugar, when you drink, too much
like I
sweet
said,
things?
like I said earlier, if you don't have any issue with insulin or you don't have a family history of diabetes, taking
Yeah,
sugar,
fine.
I take sugar, I take coke, I take all of that, but I don't have diabetes. Do you understand? But I am
Yeah.
predisposed to having diabetes because my father is diabetic.
Yeah.
Do you understand what I'm saying?
Yeah.
So all I just need to do is lifestyle modification, where I reduce my intake on all of that.
Alongside exercise and staying fit.
Yes. So
And then
lifestyle modification,
speaking of this,
taking okay.
it's actually leading me towards what I want to ask next. Okay, so how do one manage diabetes?
Okay.
How
So
does one manage diabetes? English.
how do people manage diabetes, or how do you prevent yourself from getting diabetic? Is that which of them is the question?
This is not prevention. This is
So you're already a diabetic.
one who's diabetic. I think maybe we should talk about, first of all, how to not get it, which I think you've already spoken about it a bit.
Lifestyle modification.
Yeah.
Lifestyle modification. So if you take alcohol, if you smoke, anything that can damage the pancreas, directly or indirectly, is a problem. So you could have infection, you could have cancer of the pancreas. Those things can, affect the pancreas way of functioning. Do you understand? So if
Yeah.
for someone who takes alcohol, for someone who, smokes, you have to stop. And then you start taking fruits, you start doing a lot of exercise. Exercise in the sense that for someone who is obese, it could help you understand, and then it could also prevent. Do you understand? Now, for someone who's already diabetic, before now we used to say they should stop taking any food that has carbohydrates, or do you understand? But right now we say they should eat this diabetes. I said sorry, not eat diabetes. They should eat these foods, but in small quantities. So if you used to eat fufu, that is the size of my hand, divide it into 4 and eat a
Into
portion
4.
of it. Yes, and eat a portion. But anytime you're hungry, you have to eat.
Okay.
You understand? And now, depending on the types, maybe type 1 or type 2. So type 1s are usually, they will usually use insulin for them. Type 2, you can use oral medications. So for type 2, if you eat this small quantity and, the both insulin and the oral medications will help. Do you understand? They're like, it's more like BP medications, for instance, that are helping you to regulate your blood pressure. So
Okay.
this is like this insulin that pushes this into the cell.
Okay.
So that is how a diabetic. So you take your medications frequently. I've seen some people that will come and tell you, oh, they told me my sugar level was low, so they said I should not take it, or they told me my blood pressure was low. So we just say withhold, not like completely stop, withhold the medication, like taking the medications, or they can decrease the dosage.
Okay.
You understand?
Okay. Okay. I think that's mainly what I want to ask you, Sha. I think you've really spoken a lot of the things I want to ask you. So, Sha, you see, I was nice. I'd not asked any hard question. But anyway, Sha, in conclusion, Sha, and if I'm to add a little bit to what Dr. ID has been talking about since.
Yeah.
In essence, either ways, if maybe you're trying to prevent or you already have it, the key thing remains you have to maintain a healthy diet. You also have to exercise. So, and watch your blood.
And it's always advisable. Yeah. It's always advisable to do a routine checkup. It's always advisable to do a routine checkup. Because some people don't know
with a glucometer.
that they have. Yes, some people don't know that they have it, like they have diabetes. So
because they don't check it at all.
Yes, you just see someone come to the hospital and tell you, oh, I've been feeling weak. And then you check the person's sugar level and it's really high. Do you understand? So it's always good to do a routine checkup of blood pressure, blood sugar level, so that if anything happens, it is there's no treatment for most of these things. It's managed.
Yeah. Okay. Anyway, this year's theme for World Diabetes Day is Nurses Make the Difference. So it's focused on ensuring that nurses are well educated and they are equipped with skills that would help them help those who have diabetes. So the World Diabetes Day organizers are hoping to train more nurses this year so that they would know more about diabetes. So they can assist those because nurses encounter, like, nurses are the people you see when you enter the hospital and so they need to
Sorry,
they
I
need
have
to
a
ask
question.
Huh?
I have a question.
Wow. Ask.
Can you tell your viewers what da means?
Really? It means exactly that. Blah blah blah. But actually, I didn't actually realize that I mentioned that. But what I'm trying to say is that nurses should be educated so that they can assist those that have diabetes. For this year's theme, just this year's theme anyway. That does not exclude other health workers, okay, that's ID, and my colleagues, medical laboratory scientists. Thank you.
No, I even like the idea that they should educate them so that the workload is pulled out from us.
Yeah, Well, it's true anyway, because they get to give a little insights, and then so that when they now meet the doctor does not really have, a lot of things to say. Anyway, this is what we're going to draw the curtain and conclude. Thank you very much for joining. Thank you very much for sharing your
Peace out.
Your opinion. It was really nice having you, seriously. Thank you.
Aww.
Wow, thank you guys for watching this video. It's really a pleasure sharing the information with you guys. So don't forget to SLCS. Don't forget to subscribe, don't forget to like, don't forget to comment, and don't forget to share. And I'll catch you guys some other time.